Hi everyone, this is Nurse Anna from NurseStudy.net, and today we're going to be doing Renal Genitourinary Disorders. Enjoy! And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A nurse is caring for a client with acute glomerulonephritis who suddenly develops periorbital edema and hypertension. Which nursing action is most appropriate? A. Restrict the client's protein intake. B. Elevate the head of the bed and notify the healthcare provider. C. Insert a urinary catheter to monitor output. D. Administer prescribed diuretics and reassess blood pressure in 2 hours. Correct answer, B. Rationale: periorbital edema and elevated blood pressure indicate worsening fluid overload, a complication of glomerulonephritis. Elevating the head of the bed promotes breathing, and the provider must be notified to reassess treatment. Question 2. A client with nephrotic syndrome is admitted with severe proteinuria and hypoalbuminemia. What is the nurse's priority assessment? A. Daily weight. B. Presence of skin rashes. C. Bowel sounds. D. Pupil response. Correct answer, A. Rationale: daily weight provides critical data on fluid retention, a hallmark complication of nephrotic syndrome. Sudden increases suggest worsening edema and risk for pulmonary compromise. Question 3. A 60-year-old male with benign prostatic hyperplasia, BPH, reports urinary hesitancy and incomplete emptying. Which finding requires immediate nursing intervention? A. Residual urine volume of 250 milliliters. B. Burning with urination. C. Intermittent stream. D. Reports getting up 2 to 3 times per night to void. Correct answer, A. Rationale: a post-void residual of 250 milliliters indicates urinary retention, increasing risk of infection and hydronephrosis. It requires prompt intervention. Question 4. A nurse is reviewing labs for a client with chronic kidney disease, CKD. Which result requires immediate attention? A. Hemoglobin 10.8 grams per deciliter. B. Potassium 6.2 milliequivalent per liter. C. Creatinine 5.1 milligrams per deciliter. D. BUN 60 milligrams per deciliter. Correct answer, B. Rationale: hyperkalemia can lead to life-threatening cardiac dysrhythmias. This level is critically high and demands urgent intervention. Question 5. A nurse is caring for a post-op client who had a transurethral resection of the prostate, TURP. Continuous bladder irrigation, CBI, is infusing. The nurse notes bright red urine with clots. What is the priority action? A. Clamp the catheter. B. Increase the rate of CBI. C. Administer pain medication. D. Irrigate the catheter with normal saline. Correct answer, B. Rationale: bright red urine with clots indicates active bleeding. Increasing the CBI rate helps flush clots and prevent catheter blockage. Question 6. A client with polycystic kidney disease reports a sudden sharp flank pain and hematuria. Which action should the nurse take first? A. Measure vital signs. B. Encourage fluid intake. C. Administer prescribed analgesics. D. Collect a 24-hour urine specimen. Correct answer, A. Rationale: sudden flank pain and hematuria can indicate cyst rupture or bleeding. Assessing vital signs helps evaluate hemodynamic stability and guides further action. Question 7. A client receiving peritoneal dialysis reports abdominal pain and the dialysate appears cloudy. What is the nurse's priority action? A. Administer prescribed analgesic. B. Document the findings and notify the provider. C. Stop dialysis and send a sample for culture. D. Reassure the client and continue monitoring. Correct answer, C. Rationale: cloudy effluent and abdominal pain suggest peritonitis. Dialysis should be stopped and the fluid cultured to identify causative organisms. Question 8. A nurse is caring for a client with end-stage renal disease, ESRD, scheduled for hemodialysis. Which finding would require notification of the provider before initiating dialysis? A. Potassium level of 5.5 milliequivalent per liter. B. Arteriovenous fistula with a weak thrill. C. Blood pressure of 152/84 millimeters of mercury. D. Mild fatigue. Correct answer, B. Rationale: a weak or absent thrill may indicate thrombosis of the fistula, compromising dialysis access. The provider must be notified before proceeding. Question 9. A client with pyelonephritis is receiving IV antibiotics. Which nursing assessment best indicates effective treatment? A. White blood cell count decreases from 15,000 to 13,000. B. Client reports burning resolved. C. Urine output remains at 30 milliliters per hour. D. Temperature decreases from 102.4 degrees Fahrenheit to 99.2 degrees Fahrenheit. Correct answer, D. Rationale: a drop in temperature is a primary indicator of infection resolution in pyelonephritis. It reflects improved systemic response to treatment. Why not A. WBC drop from 15,000 to 13,000? While a decreasing WBC is a positive trend, it's not the best or most immediate indicator of clinical improvement. Here's why. WBC count. WBC counts lag behind real-time improvement. WBCs can remain elevated for days after the infection begins resolving. Question 10. The nurse is caring for a client post-kidney transplant. Which assessment finding requires immediate intervention? A. Serum creatinine of 2.1 mg per deciliter. B. Urine output of 40 milliliters per hour. C. Low-grade fever of 100.6 degrees Fahrenheit. D. Blood pressure of 138/88 millimeters of mercury. Correct answer, A. Rationale: elevated creatinine may indicate acute rejection. Even with mild symptoms, this lab change requires urgent evaluation and provider notification. Question 11. A client with suspected acute kidney injury, AKI, is oliguric with serum BUN of 65 mg per deciliter and creatinine of 4.0 mg per deciliter. What is the nurse's priority action? A. Administer IV fluids rapidly. B. Notify the provider and hold nephrotoxic medications. C. Insert a Foley catheter to monitor output. D. Prepare the client for dialysis. Correct answer, B. Rationale: in AKI, elevated BUN creatinine with oliguria suggests renal impairment. Nephrotoxic meds should be held immediately to prevent further damage. Question 12. A client with end-stage renal disease on hemodialysis reports severe leg cramps and dizziness during treatment. What should the nurse do first? A. Reposition the client flat and assess blood pressure. B. Slow the dialysis rate. C. Administer muscle relaxants. D. Apply warm compresses to the legs. Correct answer, A. Rationale: hypotension is common during dialysis and can cause cramps and dizziness. Repositioning and assessing BP addresses the likely cause. Question 13. A nurse is teaching a client newly diagnosed with calcium oxalate renal calculi. Which dietary recommendation is most appropriate? A. Increase spinach and beets. B. Restrict protein intake. C. Avoid calcium-rich dairy products. D. Limit intake of nuts, tea, and chocolate. Correct answer, D. Rationale: oxalate-rich foods like nuts, chocolate, and tea should be avoided. Spinach and beets are also high in oxalate but were not the best fit here. Question 14. A client develops hematuria and flank pain 12 hours after a renal biopsy. What is the nurse's immediate action? A. Encourage oral fluids. B. Assess the biopsy site and vital signs. C. Administer PRN analgesics. D. Apply heat to the flank. Correct answer, B. Rationale: hematuria and pain post-biopsy may indicate bleeding. Vital signs and site assessment are essential to determine hemodynamic status. Question 15. A client with chronic kidney disease, CKD, is receiving erythropoietin. Which lab value should the nurse monitor to determine effectiveness? A. White blood cell count. B. Hemoglobin level. C. Serum albumin. D. Creatinine clearance. Correct answer, B. Rationale: erythropoietin stimulates red blood cell production. Hemoglobin is the best marker to assess treatment response. Question 16. The nurse is caring for a client with nephrolithiasis awaiting lithotripsy. Which finding should the nurse report immediately? A. Flank discomfort. B. Pink-tinged urine. C. Temperature of 101.3 degrees Fahrenheit. D. Urinary urgency. Correct answer, C. Rationale: a fever may indicate a urinary tract infection or urosepsis, which must be addressed before lithotripsy to prevent complications. Question 17. A client with peritoneal dialysis develops abdominal distension, fever, and cloudy effluent. What is the nurse's priority intervention? A. Administer prescribed antipyretic. B. Notify the provider and obtain a culture of dialysate. C. Flush the catheter vigorously. D. Slow the dialysis exchange rate. Correct answer, B. Rationale: these symptoms indicate peritonitis. Culturing the dialysate is necessary to identify the organism and initiate antibiotics promptly. Question 18. A client is admitted with urosepsis and has a urinary catheter. What is the nurse's first action? A. Begin prescribed IV fluids. B. Discontinue the urinary catheter. C. Notify infection control. D. Check for drug allergies. Correct answer, B. Rationale: indwelling urinary catheters are a common source of infection. Prompt removal reduces the infectious source while supportive care begins. Question 19. A nurse is reviewing discharge instructions with a patient treated for Lyme disease. Which statement indicates the need for further teaching? A. I should complete all of my antibiotics. B. I can stop checking for ticks now that treatment is done. C. I need to report any new joint pain or rash. D. I'll wear long sleeves when hiking in wooded areas. Correct answer, B. Rationale: phosphate binders must be taken with meals to effectively bind dietary phosphorus and prevent hyperphosphatemia. Question 20. A client is recovering from a kidney transplant. Which finding requires immediate action? A. Blood pressure 142/86 mm of mercury. B. Urine output of 35 milliliters per hour. C. Serum creatinine of 2.4 mg per deciliter. D. Low-grade fever of 100.2 degrees Fahrenheit. Correct answer, C. Rationale: a rise in creatinine may indicate acute rejection. Early detection is critical for intervention and graft preservation. Question 21. A client with nephrotic syndrome is at risk for developing which complication requiring immediate nursing assessment? A. Hypernatremia. B. Deep vein thrombosis. C. Hypocalcemia. D. Hypoglycemia. Correct answer, B. Rationale: nephrotic syndrome causes loss of protein in urine, including antithrombin 3, increasing clotting risk. DVT is a common and dangerous complication. Question 22. The nurse is caring for a client with acute tubular necrosis, ATN, in the oliguric phase. Which lab value is most concerning? A. Bun 48 mg per deciliter. B. Sodium 130 milliequivalent per liter. C. Potassium 6.5 milliequivalent per liter. D. Hemoglobin 9.1 grams per deciliter. Correct answer, C. Rationale: severe hyperkalemia is life-threatening due to the risk of cardiac arrhythmias. It requires urgent treatment in clients with ADN. Question 23. A client with end-stage renal disease reports persistent nausea and metallic taste. Which lab value correlates with these symptoms? A. Phosphate 3.2 mg per deciliter. B. Creatinine 7.8 mg per deciliter. C. Hematocrit 36%. D. Potassium 4.9 milliequivalent per liter. Correct answer, B. Rationale: elevated creatinine is associated with uremia, which causes symptoms such as nausea, anorexia, and metallic taste. Question 24. The nurse is preparing a client for an IV pyelogram. What is the nurse's priority assessment? A. Time of last void. B. History of shellfish allergy. C. Blood urea nitrogen level. D. Abdominal girth. Correct answer, B. Rationale: IV contrast dye used in pyelograms may cause allergic reactions. Shellfish or iodine allergies increase this risk and must be assessed first. Question 25. A client with autosomal dominant polycystic kidney disease, ADPKD, is being educated on self-care. Which statement indicates a need for further teaching? A. I will check my blood pressure regularly. B. I will avoid contact sports. C. I should increase my protein intake to prevent wasting. D. I'll watch for blood in my urine. Correct answer, C. Rationale: high protein intake may worsen kidney damage in ADPKD. Protein should be moderate and based on renal diet recommendations. Question 26. A client with chronic kidney disease is being evaluated for anemia. Which mechanism best explains the anemia? A. Decreased iron absorption. B. Suppressed bone marrow activity. C. Decreased erythropoietin production. D. Loss of folic acid in urine. Correct answer, C. Rationale: in CKD, the kidneys fail to produce adequate erythropoietin, the hormone that stimulates red blood cell production, leading to anemia. Question 27. A nurse is caring for a client who had extracorporeal shock wave lithotripsy, ESWL. Which finding requires immediate follow-up? A. Hematuria. B. Dysuria. C. Severe flank pain unrelieved by medication. D. Bruising at the site. Correct answer, C. Rationale: severe, unrelieved flank pain post-ESWL may indicate ureteral obstruction or hematoma formation. This requires immediate evaluation. Question 28. A client with uremic encephalopathy is admitted with confusion and hysterexis. Which intervention is the priority? A. Reorient the client frequently. B. Administer lactulose. C. Prepare the client for dialysis. D. Monitor liver enzymes. Correct answer, C. Rationale: uremic toxins affect the central nervous system. Dialysis is the definitive treatment to remove these toxins and improve mental status. Question 29. A nurse is caring for a client with pyelonephritis. Which assessment finding requires immediate intervention? A. Costovertebral tenderness. B. Fever of 101.5 degrees Fahrenheit. C. Heart rate of 122 beats per minute. D. Burning with urination. Correct answer, C. Rationale: tachycardia in the setting of infection can indicate sepsis. This is a priority concern and requires immediate evaluation and possible escalation. Question 30. A client with a newly created AV fistula for hemodialysis asks how to care for it. Which client statement indicates proper understanding? A. I will carry heavy groceries with this arm to build strength. B. I'll sleep with my arm under my head to elevate it. C. I will check for a thrill every day. D. I'll wear tight sleeves to protect it. Correct answer, C. Rationale: the client should check for a thrill daily to ensure fistula patency. Pressure, tight clothing, or using the arm for lifting can damage the access site.